Thanks. I know so many of you are essential workers and have been out during this, and thank you for engaging the way you have. And I'm sorry the risk that you've all faced, and I hope you're well, and thank you for being here. Commissioner Roberts, good to see you again after more than a year. And Mr. Edmondson, thank you. And Mr. Edmondson owns a shop that he will be talking about in which part of town are you?
East side.
On the east side of Columbus. As walking through here is so impressive. Dr. Roberts told me that those who are taking Pfizer, 99% of them have gotten the second shot. There's almost no fall off, and that's to the credit of those people getting the vaccines, but it's also to credit of the health department keeping good records and doing the follow-up, talking to nurses over there and talking to community health workers and others. It's so clear to me that how committed they are, how they talk to their friends to make sure their friends are going to get vaccinated, and frankly, people trust their nurse or their doctor or their neighbor or their husband more than they're going to trust a public official or the media or anybody else in making sure they get this vaccine. And that's really what the rescue plan's all about. The President Biden promised at the beginning, on January 20th, he promised 100 million shots in the first 100 days, 1 million shots a day. We have doubled that number in the first 100 days, and we are seeing as many as 3 million people a day get this vaccine. In Columbus, the numbers are down a little bit as they are all over the country. The numbers coming in every day, but we're still making a lot of progress. We need to show people vaccines are safe and effective. Everybody I know that's gotten one, the worst that's happened is the day after the second one. They get a little nauseous, they get a little sick, they may miss a day's work. I had a sore arm, is all I had on either of my 2 shots. That's the case for the great majority of people, and this is so important. So I'm going around the state and talking to people about how important this vaccination is. And we know the other thing, that grandparents are seeing grandchildren for the first time. I have 5 grandchildren in Columbus. I got to be in the same room, and most of them all 5 of them are really small, and got to be in the same room and play chess or put a train set together on the floor with them, something that frankly I haven't gotten to do in a year, as so many haven't. People are visiting family in nursing homes, seeing friends they haven't seen in a year. But it's not enough for people to hear from me or Dr. Fauci or Governor DeWine. It's really so important that people in their communities talk to each other, listen to their nurse, listen to their doctor, listen to their spouse or their cousin who's been successfully vaccinated. I'll close with this before turning it over to Commissioner Roberts. At the State of the Union the other day, the president said a nurse told him that every vaccine she administered was, quote, like giving a dose of hope. Every vaccine she administered was like giving a dose of hope. This is so important. I urge people all over Central Ohio to get these vaccines. I'll turn it over to Commissioner Roberts. Dr. Roberts, thank you.
Thank you. Thank you, sir. Well, good afternoon, everyone, and thank you so much, Senator Brown, for being here and really for all of your support for public health, not only during this pandemic, but even before the pandemic. We really appreciate your partnership, so thank you. We appreciate the support of all of our federal partners so that we can reach our goal of finding community immunity and vaccinating as many individuals as we can right here in Columbus and in Franklin County. Those efforts and that partnership and support we've gotten from the federal government has really allowed not only Columbus Public Health, but many of our other partners to provide the needed services during this pandemic. Safe and effective COVID-19 vaccines are the most important tool that we have to get to the other side of this pandemic. Many of you have heard me say that over and over again, and as the Senator mentioned, it really is a shot of hope. We've had individuals come through our drive-through clinic here as well as our other clinics and just start crying after they've been vaccinated because they are so hopeful of what's to come now that they are vaccinated and can go and enjoy other activities with their family and friends and feel protected. We really all have a role to play in this. If you've already been vaccinated, kudos to you. Thanks for all you've done. I challenge you to find someone who hasn't been vaccinated, whether it be your family member, whether it be your coworker, or whether it be your neighbor or your friend, and encourage them to get vaccinated. Remind them that them getting vaccinated is showing you that they care about you as much as the individual getting vaccinated. It's an expression that they care about their own health. Currently, here in Franklin County, 33% of our population is fully vaccinated. That is not going to get us to community immunity, also known as herd immunity. We need many more people to roll up their sleeves to help us accomplish that community immunity. We need everyone to get vaccinated. Vaccinations are readily available here in Franklin County. Anyone currently 16 years of age and older is eligible for the vaccine. They can get vaccinated at Columbus Public Health by calling us at 645-1519 or going to our website, columbus.gov/coronavirus. We also take walk-ups. You can get vaccinated here at the fairgrounds. We're open Monday through Saturday. And then at our health department at 240 Parsons, we're open Monday through Friday. So there are multiple options in addition to Columbus Public Health to get vaccinated. You can go to your healthcare provider, you can go to a local pharmacy or retail outlet, you can go to the federally qualified health centers, and we have a host of pop-up clinics that we're offering throughout the city. One today is at Community Development for All People on the South Side. So people shouldn't say they can't get vaccinated because they don't know where to go, because vaccines are readily available, and if you need help figuring out where to go, give us a call at 614-645-1519. I would just remind everyone, as the senator said, these vaccines are safe and effective. We have 3 very good vaccines on the market right now: Pfizer, Moderna, and Johnson & Johnson. Most vaccine providers will let you pick which one you want. And it's important that if you're 16 to 18, the only vaccine you can get is the Pfizer vaccine. Again, getting the vaccine is a way to protect yourself as well as the people around you. I strongly encourage those who have not been vaccinated, roll up your sleeves, get vaccinated as a way to protect our community and get us to the other side. So thank you so much, and I think I'm going to pass it back over to the senator. So thank you, Senator.
Thank you, Dr. Roberts, for your stellar work at the Columbus Health Department. I'm my honor to introduce Al Edmondson. Owns a barber shop on Mount Vernon Avenue in Columbus. He is the barber for Joe Gilligan's son from our office, so that's not his biggest claim to fame. His biggest claim to fame really is his shop and his activism in the community, and we're thrilled that he's here. Mr. Edmondson, good to see you.
Okay, thank you. First of all, I want to thank Sherrod Brown for coming down, and I really appreciate you. And Dr. Roberts, you're doing a fantastic job. Thank you so much for making sure people in Franklin County get vaccinated. And I want to say, I was like most African American men who had a lot of skepticism about getting the vaccine. One of the things after I started looking at the statistics on how African Americans and Black and brown people were being affected by COVID-19, it made me begin to think about getting the vaccine. After losing some family members, some friends of mine during the pandemic, I finally got my vaccine last month. And I'm glad that I did it because I want to make sure that I protect my family, my customers, and my community. And I just want to encourage, if you haven't gotten vaccine yet, if you want to get back to the things that you love, that you get the vaccine. Thank you.
Questions for any of the 3 of us?
Yes, Kevin.
Hi, Eric. How are you? It's anticipated that the CDC and the FDA are expected to approve the Pfizer vaccine possibly this week sometime for those that are 12 to 15 years old. What should Columbus Public Health, what should schools be doing, or is there a plan in place if that does get approved for that kids can get the vaccine? And I think there's also a concern that in order to get the vaccine, you can't have your pediatric vaccine 2 weeks prior or 2 weeks after. That's going to cause some scheduling for parents about how to get it all. Can you address those issues and how
Sure.
parents can prepare for that.
Sure. So just to repeat the question in case any of you couldn't hear, the question was that FDA might be giving the EUA for the Pfizer vaccine for those who are 12 to 15 any day now. Columbus Public Health is very much aware of that, and we are prepared to offer that not only here at the fairgrounds but also at the health department. We know that during this pandemic, childhood immunizations have been down because of access to pediatric care and other health care. So starting Monday, which is May the 10th, our immunization clinic is going to reopen for all of our childhood vaccines that many kids have missed, and make sure those kids are prepared to go back into the classroom in the fall. In addition to that, individuals who want the COVID-19 vaccine in that age group or any other age group can come to the health department to get vaccinated. As you are right, Kevin, vaccines have to be 2 weeks apart. So we're going to want to make sure we get that COVID-19 vaccine now and in that age group so that they can wait that 2 weeks if they have other vaccines they're going to need to matriculate in school in the fall. We're going to work with the school districts. We're planning to work with our Rec and Parks department that's having summer camps. We're going to look at a number of different activities that are going on in the summer, whether it's food giveaways, where families will be coming with kids of that age, to make sure we are in a position to get that population vaccinated as quickly as possible. So it is on our radar, and we're prepared to provide that vaccine to that population.
You mentioned that vaccines are down. If you were to expand the opportunity 7 days a week instead of Monday through Friday, do you think that would make a difference? Is that something you're looking at?
Well, so we're offering a variety of what we call pop-up clinics, so going out in the community. So we're trying to meet people where they are. Some of those pop-up clinics will occur on the weekends, whether that's Friday evening, Saturday, or Sunday.
Do you attribute the slowdown in the vaccination rate, and is it alarming to you?
It's a concern, as Dr. Roberts would suggest. It's a concern until we get everybody vaccinated, until we've reached whatever levels we need to reach. It's still a challenge. There are, I mean, of course, the early, as soon as they're available, many of us get the vaccines. But the reason I'm hopeful is in my conversations with the governor and public health officials, we know there are tens and thousands of Ohioans, millions across the country, that have kind of waited to see their friends get them, their family members, their neighbors, their co-workers, just to see if they're safe. And it's clear because of the record of public health in Franklin County and beyond that these vaccines are safe. So as more and more people see in rural areas where the take-up has been a little less than in the metro areas, that people are seeing that these vaccines are safe. So I'm confident that, but I also know we've got to continue our efforts. That's partly the importance of Congress moving on legislation that we've been pushing on public health generally to reach people and to build confidence that these vaccines are safe.
The government says it's going to reallocate or refigure out how it's going to allocate doses and reallocate them to places where essentially people want them. Do you see Ohio negatively impacted by that?
No, I think that we've had a good enough vaccine program in response to the pandemic that Ohio will be up pretty high on that list. We will get enough vaccines from the vaccine makers and from the federal government. I'm not concerned about that. Our challenge is, and that's why Dr. Roberts said, once you've had your vaccine, go find somebody else that hasn't. One of the nurses I talked to has a friend. I said, so to the 4 nurses there, I said, do you know people, do you have friends that aren't vaccinated? And one woman said, I have one person, and she kind of smiled, and she's, if you can see, smile through masks, and she said she's sort of my project, and that's what's going to happen, where so many people that are trusted, doctors, nurses, family members, will be one at a time getting people vaccinated, and that's why I'm optimistic.
Announced that if 70% of America is vaccinated, that states should go back to pre-pandemic life. Are you okay with that benchmark? Do you think 70% is a good mark to go back to where we were?
I don't feel qualified to make that determination what the percentage should be. I'm not a doctor. I'm certainly not a public health official. I know that what this president's doing, he's listening to the CDC. I mean, imagine if 15 months ago the president had listened to CDC, we would be in a much better position. So whatever advice he's giving to the American people is, I am certain, coming from CDC and NIH research and people like Dr. Roberts who absolutely know what they're doing.
Of your own Senate to wear masks when they go to work, and they're not doing it. What's your message to those people?
Well, most of them are doing it. One of them that's an MD isn't, but he's kind of a lunatic. Most senators are wearing them. Most senators do what they need to do. Most of us realize, even when we're around other people that we know are vaccinated, it's important we wear masks. One, so to make sure everything's safe, and second, to set that tone. I've worn a mask for the last 15 months whenever I speak, or last, 12, 13 months, whenever I speak on the Senate floor. The senators that have refused, and you're obviously talking about Dr. Paul, I don't know what his gig is. That he thinks that he just wants to be different, but it doesn't serve the public interest, and he knows I think that, and he knows, frankly, most of the Senate thinks that, in both parties. Yeah.
What do you want to see in the infrastructure bill making its way through Congress? How can that help Ohio specifically?
I'm sorry, what did I say again?
What do you want to see in the infrastructure bill running its way through Congress now, and how can that help Ohio specifically? The infrastructure bill. How can that help Ohio specifically?
Yeah, the infrastructure bill is going to do a number of things. It's going to put millions of people to work. Our unemployment is still, there are still millions of people out of work. Our unemployment, the infrastructure bill is going to put people back to work in good paying, often union jobs. It's going to add to our clean energy economy. That's especially important. It's going to make our public transit system work better. It's not just highways and bridges and water and sewer systems. That's essential and that's important, but it's also education, it's also housing, it's also broadband. We know from my dozens of Zoom calls I did, especially early in the pandemic, how many students in Columbus and in Appalachia simply couldn't do their schoolwork because they didn't have good internet connection. No matter what the school district tried to do, so many people don't have good telemedicine because of lack of internet connection. So broadband is to this generation what electrifying the countryside was to FDR in the 1930s. And it's going to help Ohio specifically because we have pockets of lots of places in the state where we don't have internet connection. Well, that people aren't connected like they need to be. We will see, I will work with ODOT in Columbus around the state to make sure that we're in line on all the kinds of projects that we need dollars for, the traditional projects. I'm working with CODA on making sure that transit dollars, 20% of the infrastructure, transportation dollars go to bus and transit systems. Columbus, as you know, from the huge victory on the east side from Cleveland Avenue to downtown, what we were able to do, the one of a kind in the nation. We'll continue to look for that kind of innovation with CODA and with public transit all over the state.
We have time for one more question, folks. A little off topic. Ohio Republicans are considering several changes to election laws in the state. As a former Secretary of State, what do you think of that proposal? And on the federal level, do you think that the Senate bill on the voting changes is going to make it through?
It's essential we pass the voting rights bill. Typically when a party loses an election, and I've seen it with Democrats, we reassess our message and our positions and our outreach. When Republicans lost this year, instead of reassessing their positions, they decided they want to choose who the voters are. Rather than voters choosing the politicians, they want the politicians to choose the voters. And they know it's wrong, they know it's un-American to try to suppress the vote. That's what they're doing. Secretary of State LaRose is doing it, the House is doing it, the Senate's doing it. I don't know if Governor DeWine's part of it, but I hope that he refuses to sign any one of these bills that suppresses the vote.
Thanks, guys.
Thank you.
I mean, well, one thing, I ran the state's election systems 35 years or so ago. We have a good election system. We do it very bipartisanly in Ohio. Same number of poll workers of each party, same number of Board of Elections members of each party, and we've never had complaints about any serious fraud in this state. This is all fabricated so that Secretary LaRose and the Speaker of the House and the President of the Senate can please Donald Trump and the new Donald Trump Republican Party. It's really as simple as that. All right. Thanks, everybody. Good to see you all.
Thank you, Senator.
Thanks, Dr. Roberts.
Appreciate it.
Nice going.
Nice. All right.
Thanks for sharing your story.
So how much of